Cogmission is a clinic that's been specifically set up to help support people who are going through cognitive decline, patients with Alzheimer's, patients with mild cognitive decline, and also a clinic that's helping with patients in a preventative way.
For many years I was struggling within my own practice around what to do with patients with cognitive decline. So when I came across the work of Dr. Bredesen, there was suddenly a glimmer of hope that there would be something we could offer in terms of not just prevention of cognitive decline, but potentially even reversing some of these patterns.
I was trained as a neurologist and neuroscientist and had a lab for 30 years where we studied the basic mechanisms of neurodegeneration, and the idea was, could we understand the fundamental nature of the neurodegenerative process? So the classical approach to complex chronic illnesses like Alzheimer's disease is what we call a silver bullet. You're looking for that thing, just as you have penicillin for pneumococcal pneumonia. The idea is to get a silver bullet for this disease. And of course that has failed so far. The disease is complex. And so what we really need is more like silver buckshot instead of a silver bullet, where you're really targeting all the different things for each person. And we typically find that people have between 10 and 25 different contributors. Some people may have insulin resistance as one of their contributors. Some people may have a couple of different specific pathogens. Some people may have leaky gut as an example. So on and on and on. There are typical multiple things that will do this. And so what we've done is use this so-called silver buckshot approach of targeting the different things.
The thing that I love about this approach is the fact that Dr. Bredesen has designed and implemented an approach that covers everything, the kind of mainstream medical approach where we're using lots of diagnostic blood tests, which are critical, so we can actually objectively measure what we're doing, right through the spectrum to nutrition. Nutrition is a strong focus, to supplementation and to herbal medicine. And this is a really strong and important part of Dr. Bredesen's protocol, which is our field. It's what we are expert in, it's where we specialise. So it encompasses everything that we do. And the first patient that we started working with, our patient zero as we call him, I mean, he really got quite dramatic results. He was a gentleman that wasn't driving. He was quite severely debilitated, and he, at the end of the kind of initial care that we had with him for maybe 6-9 months with him, he was back driving again, and he was recognising his wife, and he was regaining his memory, and we saw it in practice, and that was the thing that made it so exciting for us, and that made us then think, right, we need to work seriously at building a clinic together. And invited Jackie, our nutritionist, to join our team to work with Dr. Bredesen's protocol.
I think if we work on homocysteine, more importantly than the cholesterol at the moment.
I am so inspired by the research that Dr. Bredesen has done in this field, and it was the first research that I saw that made complete sense. We're not looking at a monotherapy here. There's so many things that need to be addressed in a holistic way, looking at a whole lifestyle, looking at nutrition, looking at sleep, looking at exercise, looking at stressors, looking at toxicity, looking at basically a person's whole life and how they've lived that life, and taking that into account and trying to address any of these assaults on the body to get some balance back. And nutrition plays a massive, massive part of that.
Okay, so we can bring down cortisol, bring down insulin,
increase vitamin D,
work on homocysteine
with some B vitamins.
It's quite complex, and it takes multiple different approaches to get the end result that we want. So it's a lot for one practitioner, because it's very rare to find one practitioner who has all these skills, whereas all of us combined have the skills. So each patient that comes to us has 3 heads looking at them rather than just one.
I was aware of the occasional forgetfulness and the occasional getting something wrong, but I think Heather, she could see this slightly worrying trend with my memory.
Yeah, I think it's been going on for a few years actually, and because you also were a bit concerned that, well, what if it is Alzheimer's? There's nothing anybody can do about it, so what's the point? So we did go and got the tests and the diagnosis. And they also at that point said, yes, there is nothing we can do except help you manage it. And so we were very relieved a month or two later to come across Dale Breasden's book and find that that wasn't the case.
So the approach that we've taken to cognitive decline is based on our laboratory work over the last 30 years. And the idea is to look at the various contributors. We call this RECODE, for reversing cognitive decline, and it looks at the various subtypes that we described, things like what's causing inflammation, what's atrophic, what's suboptimal with your various things that you're now nutrients, trophic factors, hormones. It looks at various toxins. It looks at vascular compromise, and it looks at history of trauma. And it also looks at insulin resistance. It is a whole set of things together.
There is an enzyme that breaks down insulin. It's the same little enzyme that goes in and breaks down amyloid in the brain at night. So, keeping fasting periods keeps the insulin levels lower and actually means that we end up with better housekeeping happening in the brain. So we see a whole spectrum of cognitive decline, and it can be something as mild as just not feeling as sharp as you used to, or having a little bit of brain fog, all the way through to having a diagnosis of dementia or Alzheimer's.
So when people first contact us, the first thing that we would be wanting to do would be extensive blood tests. We really want to know on a clinical basis where that patient is standing. So we do very extensive blood testing. We would also do some cognitive testing so that we can use this as a baseline, so where they are when they first come to us, so that further down the line, every 3 months, every 4 months, we can redo the cognitive testing and check their progress. Then assessing them together with their dietary lifestyle factors. We would then sit down and with all the information for that patient, put together a protocol, put together a plan, very individualised based on their blood work and their case history.
Part of the diagnostic tools we will use is neurofeedback, which has been around for about 50 years and has a lot of research behind it as well. So we're really mapping out the brain regions in terms of activity, brainwave activity. That can give us a huge amount of detail about which areas of the brain are functioning in what way. So we're looking at patterns of brainwave activity. So that can be used diagnostically, but we also use neurofeedback as a training to train the brain waves into a healthier, more optimal pattern. And that's a really powerful retraining of brain networks.
One of the important things we have to take into consideration with every patient is what medicines they're on, what drugs they're on. As a medical herbalist, we are qualified to be able to prescribe very safely alongside mainstream medicine. So we always make sure that we never interfere with the medicines that have been prescribed by their medical doctor. We would never change that. So we make sure we work around that, and we make sure that the protocols that we put together, the supplementation, the herbal medicine will dovetail and will support and won't interfere in any way with mainstream drugs.
So we're going to look at the fats that are good for brain health, fats we want in our diets, and then we'll go into vegetables and things, and really thinking about getting the best diet we can to support brain function, memory, mood, focus, clarity, all these things. Dr. Bredesen's dietary side of this protocol is called the KetoFlex 12-3. So it involves the nutrition side, but also the side of things where you're giving your body a rest and periods of not eating. And by doing this, by eating the healthy fats with proteins and lots of healthy vegetables, combined with having these periods, these rest periods of not eating where the body can rest and repair, what we see are wonderful effects where something called BDNF, brain-derived neurotrophic factor, it's like a miracle grow for the brain, that is massively increased when we have these periods of not eating. And the ketogenic protocol has shown really, really great results for improving cognitive health.
There's a change of diet, which is a big, big thing, which is changing to the keto flex diet. That's a big dominating factor, isn't it? And then there's things about trying not to eat too late because you want a gap so that you've got an empty stomach and your brain can start doing its clearing work overnight. So there's trying to manage the time of, you can't be as flexible as you used to be.
One of the first things that we ask right at the very beginning when people contact us inquiring about the protocol, we always ask, what support do you have? Are you living on your own? Do you have family members who will support you? And usually we always want family members to come with them to meet us beforehand, or at least to the initial consultation, so that they can meet with us and we can guide them. In addition to that, we've taken on our patient manager, who is there specifically to be able to call and support those who don't have family members. And so part of her job is very much to keep in touch and make sure that those patients without support and with support have got a constant communication where they can get help if they need it.
So it is important to know that this isn't a quick fix, that the program takes time because in most cases the pattern has developed over decades. So we now know that by the time people display symptoms of cognitive decline, the underlying problems have been there for sometimes up to 20 years before the symptoms are there. So we are looking at changing problems that have been there for a very long time. So typically in the first 3 months what we would expect to see is no further decline. So just a stabilization of where the person is. And then round about 4 to 6 months, that's when we're hoping to start seeing signs of improvement coming in.
It's not an easy program, this is challenging, but the alternative is far, far worse. And after about 8 months, I think, that we saw the change in you. And you can feel it as well, can't you?
Oh yes, I can.
Everybody has a family member or a close friend or of some sort who's potentially suffers with cognitive decline, and the science coming through now, it's so fast moving, it's so dynamic, and the new research is coming through and the case studies that are coming through, it's just so inspiring, and for me it's the best thing that's out there just now.
We started him on the protocol very, very early days, and already there's a noticeable difference in his speech.
Yeah.
I mean, he's only really been on it for
6 weeks,
but he is 100% committed.
Good.
Yeah.
Completely changed his diet. This is to get results, this is to change things. Cognitive decline is the #1 killer in this country. And if we can have some sort of input into that, that's the thing that drives us.
And I think also that is one of the reasons we felt we could connect very closely with Dr. Bredesen as well. Because I've certainly never met anyone in his position who works from a more kind of patient-centered, heart-centered place.
Got a high hemoglobin and high HCT and high red cell count. We see patients month on month, and we can see a difference in how they communicate with us month on month. So initially we've got some patients that come in and can barely string a sentence together, and then we had one patient in particular who came in and did the whole consultation on his own with his family members just sitting at the side. That's quite dramatic. That's just wonderful, because that patient is now engaging with his family, and you can see the change in them. That's the motivation.
I felt back in the beginning when we started on this program, I really looked upon it as a lifeboat, because I really felt my ship was filling up with water and sinking at that point. And then this happened, and we're so fortunate.
So we have a richer life together because you are yourself again, and that's great.
Yes, there's clearly some healing taking place, and I feel positive.